Gundersen has been our healthcare provider for our family since we moved to western Wisconsin in 1998.
I've been a patient at Gundersen since 1999.
I mean, I've had almost all of my medical care at Gundersen since 1995. So I guess Gundersen has kept me alive, to boil it all down.
My wife was diagnosed with cancer in the fall of 2010. She passed away in May of 2012. I often remember the kindness and compassion that were shown to us by everyone, both at the clinic and the hospital, from the receptionists to the nurses to the medical technicians and certainly the physicians. I will always remember that Dr. Edel made sure that he approached this from a personal level. We always felt like we were in excellent hands. Beth Ann's family would often send us information that they had read somewhere, and we were always able to say, yeah, we know about that, because that's the type of care that we were receiving.
I think the experience that has had the biggest impact on me was my cancer diagnosis. Dr. Lansing has been so important to me. When she did find out that I did in fact have cancer, and I went to meet my team the next day, Dr. Lansing was waiting at the counter, and she had a card for me and a hug, and you don't get that kind of treatment very often. The survivorship program really helped me adjust to the new normal. It was just a real key in me finding my way back.
Christy is very easy to talk with. She lost her sister of a cancer and shared a great deal of that. And just last April, we lost our son with cancer, and she was just so warm and held my hand and hugged me and just gave, and even when he was ill, before he passed, she gave us so many very worthwhile suggestions on how to communicate with him and so on.
I think I counted up, and between the two of us, we have 11 different surgeries at Gundersen. I had a pacemaker put in. I think that would make 12. Pacemaker put in a few years ago.
No matter which one of us was hospitalized, the other was treated with the same concern, the same dignity, the same warmth and friendliness.
Well, these were very stressful experiences.
Yeah.
And we went through all of them together. It didn't matter which one of us was the patient.
You're not just a number. You're a person, and you're important to them.
The foundation does some just marvelous things, and I think they're able to do that because there's a lot of people like me who may not be able to contribute a whole lot of money, but every little bit counts and every bit is used effectively, I think, and that's why I participate, that's why I support the foundation. I wish people knew more about the cutting-edge research that's supported by the Gundersen Foundation. Research that's done locally with local money, and I'm confident that someday that research is going to lead to more effective cures for lung cancer.
When my husband and I donate to the foundation, we hope that it will help people get the same great care that we've received. We also hope that there will be better answers for cancer patients someday. We believe that everybody is responsible for leaving this world a better place before leaving it. And if our donation can help even one person, we're content with that. I feel really strongly about the top-notch care that Gundersen gives its patients, and I urge anyone who has that same passion to find a way to help continue that.
We have donated to the foundation, but I think it was particularly close to our hearts and minds when we lost our son in April. And we wanted lots of research done. He had so many things wrong with him, and we just felt this is the best way we can help others so they don't have to go through this.
I'm John Hendricks, and this is why I give to the Gundersen Medical Foundation.
Every day, Gundersen Medical Foundation touches the lives of patients like me.
Gundersen Medical Foundation,
where your generosity changes lives.